yoga, yoga instructor class, and I hope to be an instructor when I retire as a PT, and I'm very excited to hear about your course.
Beautiful. I tell you one, I've been teaching it for years and years, but I'm just, 39 and holding. I don't grow anymore. A large number of people who are joining the yoga is from the PT, the physical therapist. And I myself had a physical therapy, and I see how they have incorporating the practice of yoga, in that physical therapy. So welcome. So you will be practicing physical therapy and you'll be incorporating yoga in your practice.
Yes, sir.
That's your goal. Beautiful. And you live here, somewhere close by?
Yes, I live in Carrollton, Virginia.
Okay. Yeah, I've been here for over 45 years. So I know all the nooks and crannies, all the sides I know very well, So is it Galina? You are on the top right now. Is it Galina or C? I cannot read. G. Is it G? Galina?
Yes, Galina.
Galina, say a few things about yourself. What brought you up to this world,
I work in the retirement community, and I do enjoy teaching, and I like to learn more about teaching yoga and the different aspects of yoga. And I really want to learn more what's Ayurveda is all about. I'm really interested in it.
Beautiful. Most important thing you should know, all of you know, yoga is extremely popular in the senior community because the two symptoms senior has is a chronic pain and a loss of balance. And you will see when you are doing all the practices, the pain comes from the tightness of your ligaments, tightness of your muscles, because all the pain fibers are there. And a whole yoga therapy practice is called a relaxation response. And it teaches a tremendous amount of balancing. So you'll be in a nice place when you go back to your work. And where are you physically located?
I work in Williamsburg, but I live in Gloucester, Virginia.
Gloucester. Somebody asked me where we're physically located. I said, my physical location is me and my laptop, Wherever I have my laptop, that's my physical location these days. So, who else? I see it here. Next, I see Melina Boyd. Melina, say a few things about yourself.
Hi, my name is, hi everyone. I'm dental assistant and I lived in Japan for 5 years and I used to practice yoga. I used to run a lot and I got injured in my back and I started to do yoga as therapy. And then I traveled to India. I fell in love in India. I learned in, when I was there, really, it changed my mind. And I want to learn more by myself. I don't know if I'm going to teach one day. Of course, I'm going to teach my family, my kids, and my friends. But yes, it's really happy to learn more about yoga and all these beautiful things.
I'll tell you one, in a whole yoga practice, your breath is a connector between body and mind. And you will be seeing, and I'll be telling to you, you'll be hearing all the time. I will be talking about your body is a hardware, mind is a software. When you fix your software, hardware gets fixed. So for a long time now, I've been going to the dentist and I do my breathing, exhalation longer than inhalation. Very simple, I'll teach you how this technique is. It quiets down your mind enough. I had a dental procedure done without even any anesthesia.
Wow.
It's a mind over body and it is being happening to all of us. And I'll tell you, because I'm a physician, I've been a Western trained physician, I've been in this country over 50 years, but again, we'll come back and you'll be surprised how much you'll be able to use this whole philosophy and practice of yoga for your, first of all, your own benefit and to help your patients. Welcome. So you live here also in Hampton Roads?
Yes, I live in Chesapeake, Virginia.
Chesapeake, Virginia.
Yeah.
Okay, let's see. Next one is Lee Lincoln. Say a few things about yourself. What brought you in
Hi.
this world of yoga, huh?
I've been doing yoga for about 20 years,
Okay.
more or less. And I've also traveled to India and fell in love and with yoga more and more. Actually, what you just said about the dentist, I sometimes need nitrous because I get so anxious. I've had, so I'm interested in, for my personal practice, to incorporate whatever that is and know your secrets. But right now I'm homeschooling my 2 kids. So I'm a stay-at-home mom and I teach 1 yoga class on the weekends. But I'm getting back into my practice and my teaching practice. And I took your other course through this 300-hour last spring, and I loved it. So I'm excited to see what else I can learn from you.
Okay. Very simple thing for all of you. Whenever you are going to have something done, as I said, dental procedure, first and foremost thing you do, just close your eyes. Okay? Just close your eyes, relax, and you say, have it your way. Let go. Let go, have it your way, and that will be the exactly thing we'll be talking about this evening, controlling your senses and what the senses does to your mind and the mind does to your body. Okay, and yeah, you look familiar to me. I remember most of the people who comes to my class, and you also live in Peninsula?
I'm in Yorktown, yeah.
Yorktown. Okay, beautiful.
Thank you.
Joya, where is Joya? You are here?
Can you hear me?
I can hear. We don't see your face. You have too much light in the back, or you don't have enough light on your face.
Okay, so let's do this. How about this? Okay, so I'm logged in 2 ways because my computer continues to tell me that it's unstable. So that's why you see me twice. So okay, I'm on my cell phone.
Okay, do one thing. Whatever you are using, other one, mute it. Mute the one. You cannot have a two. You cannot have a two input, and it will cause a tremendous background noise. Okay, I see you now.
Okay, can you hear me? Well. Okay, can you see me? Okay, all right. Okay, thank you. So, just a little bit about me. I am a mother of 6 children, range from 24 to 8 years old, and all of them are athletes. And one of the reasons, out of many reasons why I'm quite interested in yoga practice is because there's a lot of injuries in my home. So I'm a big believer in therapy through yoga. And also too, I have a huge interest in the meditative space. I was bouncing around to different yoga practices, and I never really felt like I was getting to a higher connection. I sort of felt like it was more of a competition trying to get through the poses. So my focus is to really, really enhance my personal practice to, elevate.
Beautiful. Just let me give you one simple tips. Your lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to keep it open. You have a 4.5 liter you can exchange there. When you have any kind of acute injuries, hopefully, it's not bad enough to put any stitches or to put any broken bones or joints. Other than that, breathe out first, slowly take a deep breath in and hold your breath. The moment you hold your breath, you start building up, we call it a carbon dioxide, CO2 in your blood. When you build up enough carbon dioxide, don't hold it, with some effort, just make it like effortless. Let it out again. Bring another one in, hold it. More and more carbon dioxide gets built up. It's called is a chemistry behind it is called a carbonic acid. We call it a CO2 narcosis. It acts like a narcotic. Try, I'll teach it to you. You'll see, especially we do with the kids, I have a almost 2 years old grandson. Everything he does is a yoga. And now you'll say baby. Baby will get up into a cobra pose. Baby will get into a downward facing dog. Baby will sleep. It's called the closed angle. Okay, we'll show you everything and we'll talk about it. Who is next here? I see Kalila here, Kalila Miles. Say a little bit, few things about yourself.
Hi guys, I am Kalila and I am in the 300-hour program. And I am excited to take this class again with Dr. Sarkar because every time I take his class, I learn something new. And I feel like he is like, I don't know, not a bottomless pit of information because that sounds bad. But I mean, there's like so much information in his head and I just want to sit under him and get all of it, or at least as much as I can write down and remember until the next time I take the class. So I'm excited to be here and I'm happy to see some familiar faces and then also some new ones.
I have the picture you sent me and you the picture last time. I still have it. Thank you. Thank you. Okay. Next I see Kendall.
Hey guys, I'm Kendall. I'm actually in the 200-hour program. So I needed makeup hours for one weekend that I missed. Dr. Sarkar, I've actually heard a lot about you. I've missed you a few times at Big Space. So when I saw this training being offered, I jumped on it right away and volunteered to sit in on this weekend. So Sharon and I have actually had some conversations about what we do. I've been doing fitness with geriatrics. So at first I felt really compelled to look more into yoga in hopes to share that with the population that I was working with. But the more I learn, the more I'm actually learning about myself and why I need it for me personally, which kind of sounds a little selfish. But it's just given me a new perspective as I go. So I know a little bit about Ayurveda through a previous manager that I had who's a yoga instructor. So I'm excited to learn more this weekend.
Okay, thank you. Did you leave anybody? No, I think you're all covered. Yes. First of all, just to continue your conversation, a practice of yoga is an introspection. You start looking inside yourself. And the practice of yoga is the art of self-healing. You heal yourself. Practice of yoga is transformative. It transforms yourself. And you will be seeing that what you could do before and what you do now, how much transformation you had. Same way, when you have a underlying a chronic disease, it converts into a treatment of a disease, that it converts into a called maintenance of health. So I'm going to go over with little view with what we are going to talk this whole weekend. This is going to be an exhaustive 18 hours. So we'll be all locked into this 18 hours program. There will be so many information A lot of information will be your Greek, German, Latin, Sanskrit, you name it. It's a non-English. If you can say non-English, it's all there. Literally, I'm not kidding, because when I started studying Ayurveda, I'm a Western trained physician. I'll tell you a little bit about myself. Ayurveda was, oh my God, what it is, you know. But once I understood the philosophy behind it, it is amazing that your whole life, not your whole life, every day, every moment, your life rotates around the Ayurvedic philosophy, and will come and talk to you. For the same reason, I gave you all the slides I'm going to present. So you have every information, you have all the information for the future. Please don't worry about, you know, writing it down, thinking about you didn't understand anything what I said. Go back and take a look. And also this information will be very important, valuable for you when you'll be start teaching. So this will be basically your tons of information. The first, today's topic is called Ayurvedic nurturing the senses. And what does it mean, nurturing the senses? And first of all, you all need to know what a Ayurveda is. Now, let me go ahead and see if I can put in a speaker view. So I will be the only one and all of you are muted. If you have any questions, anything, you can always unmute yourself and you can talk to me. This is a very informal session. Another very important thing is, Ayurvedically, you will see we are all different. So whatever need you have, if you want to have a stretch break, if you want to have a food break, if you want to have a bio break, if you want to have a comfort break, I'll show it to you. What are the breaks you have to do? Just take it, okay? Because we are not programmed to be the same human being that, oh yes, every hour we'll take a break, every 3 hours we'll have a little break in the session. No, just take your break whenever you want. First, the whole concept of yoga and Ayurveda, and what is the connection between these two. Most of you today, when you finish your yoga teacher's training, when you go to the world, either to teach or to work or to share with what other people, doesn't matter what, you will see 75 to 80% people who are coming to you will be coming for underlying medical condition. The word is already out that yoga helps in the chronic diseases. If you guys are interested, you know, we do what is called a search engine for National Library of Medicine. It's called a PubMed, PubMed. If you go to PubMed and just simply put a yoga therapy in your search engine, that you might like to write, because it's very important. All of you search in the PubMed, P-U-B, then uppercase M, M-E-D, pubmed.org. If you just put a yoga or yoga therapy, you'll see about 6,000 articles will come up pertaining to the benefit, medical benefit of yoga. So you as a teacher, first and foremost, you have to learn few vocabularies, because your students or your clients or your patients, whatever term you use, they're going to ask you a few things. Simply, they will ask you, what is yoga? Simply, they will ask you what type of yoga you practice. Simply, they'll ask you what is yoga therapy, why I'm here for. For you, the first and foremost is you don't practice any type of yoga. You practice yoga from the scripture. You practice yoga from the books where it came from. All the name brand yogas are given by a yoga practitioner, and it is on their brand name, which has no connection with you. You are a standalone yoga teacher. So the first, what is yoga? Yoga is an anglicized version of the root word. The root word is called a Sanskrit word. Sanskrit is the language which yoga has been written, and it is derived from called a text called the Vedas, and we'll show it to you, all of them, slowly and slowly, and see that the word is called yog. Anglicized version is called yoga, and the meaning is union. It's a union of your body, mind, and spirit. It's a union of your individual soul to the universal soul. It's a philosophy. So if you look at the philosophy is Patanjali, Yoga Sutra. Sutras are small aphorisms, and every aphorisms are so small, but it carries a tremendous amount of information. And the sutras are very small because it used to be an oral tradition from the teachers to the students. It has been practiced over the last 5,000 to 6,000 years in Indian subcontinent. And Patanjali is a person who wrote the yoga in a book form. And if you want to know who Patanjali is, and here is Patanjali behind me. If you see the statue behind me, that's the statue of Patanjali. This is actually my exercise room. I have my treadmill, my weight training, my bench, my yoga mats, all over with a statue of Patanjali. Interesting is, out of 196 sutras, 193 is to quiet down your mind. And all of you should carry that book. I said, you should carry the Yoga Sutra book, the blue book. And generally we recommend, I think most of you probably may have it now, the blue one from Yogaville. If you have not visited Yogaville, you should. It's very close to us. When I started reading the Yoga Sutras, I can tell you frankly, I didn't understand anything. First time, it just went over my head. Second time, third time, whenever it got me, I was literally hooked with it. So my joke is, if you cannot read the Yoga Sutras, take the Yoga Sutra book, put it underneath your pillow and sleep on it. You'll see slowly and slowly it will come. It will permeate to you. Practice is 8 limbs of yoga. And 8 limbs of yoga, these 8 limbs you have to memorize completely. There's no shortcut. See, yam, first one is a social restraint, niyam, personal restraint. Asana is alignment. It's a physical, internal and external alignment. Pranayama, prana, yama. Yama means control and restraint. Pranayama means you have learned how to control and restrain the prana. And I'll talk about prana, what it is. It's then subtle energy, and breath is the carrier of prana. And the pranayama basically is voluntary regulated breathing. It's not a breathing exercise. You learn how to control the breath, the pranayama. 5th is the pratyahara. Pratya means reject. Ahar means your input. All the information you get through your 5 senses. We have 5 senses. I hear, I see, I smell, and taste and touch. If I learn how to control the 5 senses, my mind quiets down. Why? In yoga tradition, mind is the content of your 5 senses. Very, very important concept. People all talk about, like, we're a Western trained physician. For us, mind is a neurotransmitters. Mind is your dopamine, oxytocin, serotonin, endorphin. Dopamine goes up, dopamine goes down, serotonin goes up. So those are mind. For yoga, it is a content of your five senses. Those content, when it became more processed, it becomes your intellect. And those are called the koshas and the sheets around you. Physical sheet, breath sheet, mental sheet, intellect sheet. When all your information get more processed, it becomes your wisdom. That is called wisdom sheet, Anandamaya kosha. But we'll come and explain to you slowly and slowly. And these are all, I gave it to everything to you. These are all in your slides, so to go back and you'll find it. So controlling the mind will be able to learn how to control your five senses. And that's what we're going to talk this evening. So after Pratyahara, sixth sense is called the Dharan. Dharan is a focus. When the mind quiets down, you are able to focus down. You'll be able to close your eyes. I have people, he comes to me first and says, I cannot even close my eyes. When I close my eyes, I get so restless that I have to open my eyes. You can learn how to focus yourself. You close your eyes. You can listen to a little nice classical music, or nice, we call it a mantra that you're chanting, or you can visualize visual imagery. You can close your eyes. You can visualize you're in front of or you're looking at a flame of a candle, or you're sitting in front of a, beach in an ocean. But when you learn how to do focusing and focusing, slowly you get defocused. And your mind literally comes to a point when the chattering of the mind goes away. What the chattering of the mind means? We generate all the thought process. In hourly basis, I don't know, thousands and thousands of thought process we generate. Throughout the whole day, the same thought process comes to me and keeps on repeating. It's called a repeat thought process. I will come here, I have to come to the class, I have to get familiar with all the people who are in the class. I have to say these things, continuously chattering. This is called your chattering of your mind. But in a practice, when you start come down to your sixth limb, you enter into the gap between your thought process. The gap gets bigger and bigger and bigger. You literally enter into a state of meditation. So remember, the seventh limb is the meditation, and eighth limb is called a samadhi, which is the union of your body, mind, and spirit. So you'll see a term we use all the time called yoga and meditation. There is nothing called yoga and meditation. Meditation is the seventh limb of yoga. It's a practice. So we'll show you how you practice, how you prepare your body and mind to enter into a meditation. So for myself, I think most of you know me by now. If you don't know me, you can ask Google. Just put my name. You have my name called Dilip Sarkar. And if you want to know what I do, how many hats I carry, the first slide of each presentation, I have all the hats. I am a surgeon. I'm a retired cardiovascular surgeon, vascular surgeon. I've been practicing this area over 45, 50 years. I had events in my life. I had a heart attack about 20 years back, had emergency open heart surgery, and that literally I have no so-called risk factors in my body, literally slowly and slowly. I started getting connected with yoga, Ayurveda, which I've been also practicing before, but I got a tremendous benefit out of it. Today, after 20 years, I'm almost disease-free, medication-free, and I'm enjoying a better quality life. And basically what I'm doing, I'm sharing all my practice, all my knowledge with all of you, so you guys can carry the flag when we are not going to be here. As simple as it is. I used to live in, see where, Chesapeake first, then a part of northern Suffolk. Now I'm in downtown Norfolk. I'm enjoying a nice city life now. I walk everywhere. Please come to Granby Street. Every other street is a nice restaurant there. Very nice, comfortable living here. So you as a practitioner, primarily you have to look more and more in a yoga therapy. And what is yoga therapy? Yoga therapy is an adaptation of your philosophy of yoga and the practice of yoga based on the client's or patient's clinical condition. What does it mean? It means when a patient comes to you, they come with a back pain, knee pain, hip pain, or they come with the asthma, COPD, heart disease, Parkinson's disease, you have to understand the clinical situation of the patient and able to have a protocol and help the patient based on the information you have. And the best way to assess a person globally is through called Ayurveda. Why? The word Ayurveda is called, Ayu means longevity, and Veda is called knowledge. The knowledge which gives us longevity, the knowledge which gives us how long we are going to live, the knowledge which is going to give it to us that what is going to happen to us today, what will happen to us in the first thing in the morning, the knowledge which gave us what we have to do when you get up first thing in the morning. It's called a daily routine. There's a dinacharya. We'll be talking about it tomorrow. But the word Ayu means longevity, Veda is a knowledge. As simple as it is, it gives you called the body type, body-mind type. We are all being completely different from each other. Those are called your psychophysical body type. Psycho means mind, physical means body. Mind, body type, and it is based on what is called a doshas. You'll be hearing more and more called Vata, Pitta, and Kapha, and we'll all talk about it, say, Sunday. Sunday we'll talk about Ayurvedic yoga therapy. So today, as I said, we will be talking about controlling your mind. Why? Because yoga and Ayurveda says that your body is a hardware in a computer words. Your mind is a software and the spirit is a programmer. And union of the body, mind, and spirit is yoga. Second question is, who is the programmer? Answer to it is, I am the programmer. One of you just mentioned, I'm doing it. I can feel it within myself, and you'll see. You can feel it yourself, and you start looking inside yourself. The moment you look inside, you can fix your mind. And we said mind fixing is like fixing your software. Like you have this cell phone, you get your software updates. The software updates is basically, it fixes the bugs. Practice of yoga is nothing but quieting down your mind. Physical body is, remember, the whole process is called a relaxation response. You'll be hearing about more and more about, one of your philosophy of yoga is called Sthiram Sukham Asanam. Sthiram is a stillness. Sukham is the happy. Asana is a pose. Doesn't matter where you are sitting in a chair or sitting, always keep your spine straight. Sit down. The moment you learn how to sit down, you sit down without any pain. If you have a pain, you back off. But stay in the posture. Stay in the posture a little bit longer and longer, and you will see slowly and slowly what you call a habit forming takes place. In medical term, it's called a neuroplasticity. When neuroplasticity sets in, you'll be able to continue it very easily. To control that, it all comes from your mind. When you learn how to quiet down your mind, you learn how to control your physical body. And also vice versa, when your physical body is relaxed, like I'm sitting down here, I'm sitting down is a nice, comfortable, cross-legged, it's called a half lotus, full lotus, and I'll show it to you where I'm sitting down. So all these postures are due to relaxation response. When you have a relaxation response, your breath becomes effortless and your mind quiets down. Since we said our mind is a content of our five senses, you have to learn how to quiet down your mind. Generally, I do show you all the techniques, and when I was doing it physically present and in the yoga studios, we're spending the whole day. I was showing how to do your, the nasal washing, gel neti, the sutra neti, even all your cleansing techniques. So let's go ahead and start. Let me share my slides and you tell me if you don't see the slides, okay? I'm sure you'll be able to see. Let me share it first with you. There is no sound here. I don't need to share the sound. Share the slides. Let me see if you can see here. Okay. Now, all of you can see my slides now. Let me see here. Anybody here who cannot see it? Okay. I am going to be on a speaker view, and all of you should put yourself on a speaker view so you'll be able to see everything. So that the topic this evening is Ayurveda, nurturing the senses. We're going to finish around a little bit 7:45, and I will leave enough time for our question and answer, little discussion, and you guys will be telling me your comments, your questions, and you will also educate me. Here I am. I told you, I've been here in this area over 45 years. I've been an associate professor of surgery in Eastern Virginia Medical School. I'm also a faculty member of a yoga university. It's called a ZYA, and this is the world's first yoga university outside India. And there is an institute in Hampton which deals with the yoga and Ayurveda. It's called a Taksha Institute. I'm the chairman of the Center for Integrative Medicine. I was a fellow of American Association of Integrative Medicine. I'm also very much actively involved with the community service. I'm still in the board of American Heart Association because of my heart issue. And I've been a president for a called International Association of Yoga Therapists. So I'd like all of you to go to their website called IAYT and take a look at it, what they provide. And you might like to be a member of IAYT, because if you're a member of International Association of Yoga Therapists, which is different than Yoga Alliance. When you get a certificate, you'll get a certificate of Yoga Alliance. This is your yoga teacher's training certificate. But for it to be yoga therapist, you have to do a more advanced training. And those trainings are long time, 500 hours, 800 hours, 1,000 hours to be yoga therapist. But again, just go to the website, take a look. I'm a life member of called a National Ayurvedic Medical Association. It's called the NAMA. You might go to their website, NAMA, and you will see called Ayurvedic Yoga Therapy. I personally, I'm a certified yoga therapist. I'm a certified Ayurvedic yoga therapist, in addition to my Western medical degrees. As a chairman also, the Board of Institute is called a Life in Yoga Institute. And here, what we have done, myself, and there is a yoga researcher from Harvard, we have been teaching that how to integrate yoga therapy in our Western medicine. And I will show it to you. I have a book. I wrote a book called Yoga Therapy, Ayurveda, and Western Medicine. It's called A Healthy Convergence. I have a DVD, but these are primarily for physicians and for the healthcare providers. And we are teaching it through, it's called a continuing medical education. And we started in 2009. So almost 12 years we are doing it. So starting presenting our topic today, that Ayurvedic nurturing the senses, why we need to balance, cleanse, and nurture our senses. So many of you may not heard the name, but it is a very famous, it is called Pattabhi Jois. He's one of the father of our modern yoga. And you should know a few names. The father of modern yoga today is called the Krishnamacharya. Krishnamacharya, it was in 1930s and 40s in India. He started teaching the yoga asanas, yoga pranayama, and he had a very four famous students. You might heard a few names. One of the students is called B.K.S. Iyengar. Iyengar came to this country, and with his name, he started a special types of yoga called Iyengar yoga. Remember, these are the names given to the Iyengar yoga, but exactly based on philosophy of yoga, practice of yoga. It is basically pick and choose. We call permutation and combination and forming. Yes. Pattabhi Jois was another student of Krishnamacharya. He started his had name called Vini Yoga. And Pattabhi Jois was it's called Southern California, called Encinitas. In fact, his son was here. People who knows about Sattik Space. Sattik Space is a very famous yoga studio in Portsmouth. And he came and he gave a session in Sattvic space, the Pattabhai Joas's son. So his beautiful statement that in our country to produce robust, intellectual, and long-lived children who believes in God, we must, in our humble opinion, learn how to control our sense organs. Basically, sense organs means you quiet down your mind, and you quiet down your mind, your physical changes in your body doesn't take place. When your mind quiets down, if even somebody comes and starts even, we call it a dumping their emotional toxin. Somebody has emotional toxin. He or she did not sleep last night, or they fight with their spouses, and they saw you, and they started dumping the emotional garbage, screaming, yelling at you. But you know what you said when you were a practicing yogi? And you said, you know, it's his problem, it's her problem, it's not mine. Your blood pressure doesn't go high up, your heart rate doesn't go high up, you stay in a state of calm. Very, very important. Ayurveda says the improper use of our five senses are the root cause of all the disease, called the chronic disease. What does it mean? What means that mind is a content of your five senses. And if you learn how to quiet down your mind, and you'll see it is going to quiet down your blood pressure, the heart rate will come down, and you'll see we all do. We practice with our a health tracker. I always practice with my Apple Watch. Sorry. I practice with my Apple Watch because I get all the health parameters when I practice it. So mind is a content of your five senses. By controlling and cleansing the senses, one achieves health of the body and the mind. And we'll show you how, step by step, how it happens. In yogic tradition, it compares the five senses to five wild horses. So when you're able to tame the horses by using the practices to balance the senses, you'll achieve health and healing of the body and mind. And I will show it to you how you do this and how is it possible to do it. And the practices you are going to go through, how to quiet down your five senses. The fifth limb of the yoga is called your pratyahara. Prata means reject, ahar means intake. Intake means intake through five senses. What you hear, what you see, what you smell, what you taste, what you touch. And it's extremely important limb is the fifth limb. And these are the terms I'm not going to go over with you now. I'll be telling you slowly and slowly, but you will understand at the end of the day what a health means. What is called Agni Dipana. Agni is your digestive fire. Agni is the fire within us. A practice of Ayurveda, I will say, ignites our fire. When it ignites our digestive fire, your food gets properly digested. Food gets digested, and I will show it to you the pictures. Our stomach is like your the stovetop. You put your food there, the food needs to be cooked. If the food doesn't cook properly, it produces a toxin. If your fire is not ignited, it forms a toxin, and the toxin is called ama. And for our Westerners, that toxin is nothing, but toxin is a high cholesterol. Toxin is a high sugar. Toxin is a high uric acid. Whatever you see in product of metabolism in the blood, those are what toxins. Ama pachana. Pachana means digest. A practice of Ayurvedic yoga therapy will digest all the toxins. Ama is the mother of all the diseases, the toxin, the high cholesterol, high sugar, high fat, whatever high you are talking about, these are the root cause of all the diseases. It causes Nadi Shodhana. Nadi is a channel. Through the channel in our body, our life force is called prana. Prana flows through your channels, and the channel gets cleaned with the practice of yoga. Finally called Oja Sthapana. Oja is your immunity. So when you have an Oja, your body immunity goes high up. And we are seeing it more and more now today, even in our COVID crisis today. People who are practicing regular yoga, they are not having even COVID-19. And it is being done scientifically. There is a project going on in Harvard University called Beth Israel Medical Center. They're collecting data. In India, there is an association called Indian Yoga Association. They're also collecting data. And they're very convinced that when you're practicing yoga, your body immunity goes high up and you can protect yourself, called exogenous disease and endogenous disease. Exogenous disease means the disease which comes from outside, and endogenous disease, the disease which comes from inside. You should have all these slides with you. I have seen a couple of the people who said they cannot open your attachment, but I had to give them a permission because these are a lot bigger, longer slide, larger files. It came through a Google Drive. One thing you have to remember, we all talk about we are what we eat. But Ayurveda says we are what we digest. When you put a food in your stomach, food needs to be digested. And Ayurveda says food gets proper digestion based on eating with 5 senses. What does it mean? You listen to the food like a sizzling food, or you listen to the sound when you are eating the food or biting the food. You look at food, you smell it, taste it, even touch it. Eating with a little hand, touching the food, exactly what we're eating. It's very important. And once the food is digested, the food converts into your energy, and then to call it ojas. There are 3 terms you'll be hearing more and more. Prana, Teja, and ojas. These are all the terms you'll be listening or hearing from the Ayurveda, but eventually you will understand, and you'll be finding out how important these are. Prana is a subtle energy which keeps us awake, alert, and alive. People tries to confuse prana with the breath. Breath is not the prana. Breath is the carrier of the prana. Metaphorically, breath will be like your, say, electric cable. Prana will be like electricity. Prana goes to the organ of healing. Prana is a psychophysical connector. It's called a pranic healing. That power causes the healing of our body and mind. It is called your cellular communication. It communicates between the cells through your channels. Tejas, on the other hand, is your fire inside within you. It's called a Agni. And when you ignite the fire within inside you, you will see you are glowing. There will be an aura around you. People who are practicing, they always say, their friend says, "Oh, you look so good. Looks like you have a aura around you." And once you have a tejas, that's your health. And ojas is the end product of your digestion. When you eat some food, the food converts into body tissues. What does it mean? When the food gets properly digested in steps, first it becomes called plasma, called Rashadhatu. This is called a dhatu. Then it's called a blood, Rakta dhatu. Then it becomes your muscle tissue. Then it becomes your fat tissue, Medodhatu. Then it's called a Asti dhatu, means of bones and joints. Then it becomes a nervous tissue. Then it becomes reproductive tissue. Then it forms a substance called ojas, which is immunity. If your digestive fire is not strong enough, the food does not convert into 7 tissues. And very simple way of looking at it is that all my body tissue is dying and replacing. My liver cells are dying and new liver cells are forming. It's called apoptosis. My older muscle cells are dying, new muscle cells are forming. I am not eating a liver to make a liver cell. I'm eating this piece of bread, I'm eating this piece of veggie, or I'm piece of this, maybe a fish or a meat that is creating all the tissues. All depends on your 5 senses. When you use your 5 senses, your food converts into appropriate tissues and your immunity. Endogenous disease means disease comes from within us. Exogenous disease is like say COVID-19, a virus coming from outside. Exogenous disease will be your allergies, the pollen which is coming. Exogenous disease will be mostly viral and bacterial diseases. But endogenous disease are like diabetes, heart disease, high blood pressure. We call it truncal obesity, and a big thing, when you have an expanded waistline, truncal obesity is a big disease today because truncal obesity brings all the endogenous diseases. What you find out, the endogenous disease, the root cause is called stress. Stress is called your sympathetic overdrive. Sympathetic overdrive means my blood pressure goes up, my heart rate goes up, my respiratory rate goes high up. But the whole practice of yoga and Ayurveda creates called a parasympathetic response. Parasympathetic is called calm and digest. As simple as it is. It's a relaxation response, activation of parasympathetic tone. So the stress, basically, what is causing stress is called a fear of unknown. I have a fear. What is my fear? My child is going to school. I don't know whether there will be a mass shooting in school. I'm going out. I don't know whether I'll catch the COVID-19 or I'm taking a airline's flight. I'm not sure what will happen to this airline. So a fear of unknown and improper use of the 5 senses. Improper means listening too much, or even less listening, eating too much or less eating. And it is a mind. The mind is called, we'll talk about it, it's called the sheath, called koshas, Manomaya kosha mind. When mind gets properly processed, it becomes your intellect, intellectual sheath, called Vijnanamaya kosha. And then it becomes a wisdom. The wisdom is called Anandamaya kosha. At the level of the wisdom, you are disease-free. At the level of your intellectual sheath, when there is an imbalance takes place between your 5 senses, your intellect still puts you back. He said, don't do it. You'll get in trouble. At the level of your mind, that all the senses starts to be imbalanced is the root cause for all the diseases. Able to balance and nurture your 5 senses, you can control and you can have a fairly good, called a health, maintenance of the health. Another term you'll see will be coming back later. You may not, most of the people don't understand at this time. Is called the improper use of your wisdom, called progga aparad. Progga means wisdom, aparad means crime. What means going against your intuition. As simple as it is that if I eat this ice cream, I know I'm going to have some trouble. But the mind says, no, go ahead and eat this ice cream. But if you don't learn how to control your mind, you are going to go in that path, and that will be the root cause of all of your diseases. Respecting the senses through cleansing. I will show you what the cleansing means. Avoiding over or under stimulation of the senses. Taking time to connect with the mind body through an inclusive yoga practices helps maintain good mind body digestion, maintains balance and optimal health. Always remember, all the information comes through your 5 senses. That also needs to be digested. You digest your food, you also digest all the information coming through your 5 senses. Now, we'll talk about a little bit about a vision, and we'll do a little bit of a practice. Now, it's already an hour, and let me show you a simple stretch break. How do you do? Because a friend of mine wrote a book. It's called Sitting Kills Moving Hills. So I'll do it to you little, in few minutes, and we'll do a little practice for your vision. So the first sense is a vision. So eye is the extension of the brain. So actually with the eye, it goes a nerve behind, it connects with your brain. So I literally, by looking at the eye, you can see what somebody's brain or somebody's mind is. I will tell you what the mind is doing. Eye exercises, which is called a tratak, which you will do it now. You'll see it, how you do it. It calms the mind. It relaxes the eye muscles, which improves the vision. What it does, the lens, when it's pulled by the 2 muscles, and lens gets more and more, less and less convex. When the muscles are relaxed, the lens is very pliable. It becomes more convex and you see better. Relaxation of the eye muscles changes the shape of the lens and it's better. People who are practicing yoga, the relaxation response, you will hardly see them wearing any glasses, including this man who is talking in front of you. I'm the envy of my family. My children wear glasses, my wife wears glasses. I'm the only one who doesn't have any glasses. In the morning, you clench your eyes when you are brushing your teeth, and I will tell you in the morning what to do, how to sit down, how to drink water, how to have an easy elimination, what is sign of health. But you also then wash your eyes. One of the yogic practices, which probably will not be too much acceptable in our Western community, is that you put some water in your mouth, then have the water in your hand, in the cup of your hand, and then rest the open eyes in that water and blink a few times, several times. I've seen it, yogis doing it. But initially I didn't understand, but now as from a medical standpoint, I understand. Your saliva in your mouth has a lot of immunoglobulin. Immunoglobulin is called immunity. It's called IgA, IgG. And you will see in the animal world, if there is a another animal has an open wound, an animal will lick it. If the baby animal has some injuries, other mother will lick that wound. And it's all because your saliva has your immunoglobulin. Meditation relaxation response to relax the muscles of the eyes, and I'll tell you how to do it, and will show you how to do it. And it increases the diameter of the lens and improves your vision. And I have seen, I'm a surgeon, I've seen you, I've seen in my practice, when a patient undergoes anesthesia, before they put them on a call it endotracheal tube, they put a tube and give anesthesia, put them on respirator, they first give a called muscle relaxant. And when the first muscle relaxant, I remember long time back, a patient says, you know, I see a crack in the ceiling. Vision gets better. He could see now there is a crack in the ceiling. It's an amazing, amazing response. When you get a relaxation, a vision gets better. Your pumping and cupping, I'll show you what is that pumping and cupping. A practice, which we'll do right now. You'll see it improves your vision. And there's a lot of scientific studies that are done. Another very important thing, when you improve your other senses, if you improve your hearing, I'll show it to you what helps you in your hearing, you improve your vision. Why? Because it's opposite. If you see a visually impaired person, like a blind person, that touch becomes very sensitive. They can touch anything and tell you what it is. I'm a person, I have a patient. She was blind from her birth. She used to come and touch my shirt. He said, you were wearing a white shirt today, or you were wearing a colored shirt today. She could even sense the color. It's that much of a cute thing. In Ayurveda, there is one practice is called the basti. It's called a netra basti. Ayurveda, what they do, they will put a dough. It is generally a flower. It's made of flour. They'll put a flour dough around the eyes. Then they put a little bit of a clear, I don't know if you've seen, it's called ghee, G-H-E-E. It's a clarified butter. It is available in all the Indian store, or there is a product called a Triphala. They'll put in the eyes and they will do some eye exercises, which is called a Tratak, T-R-A-T-A-K, Tratak. It's a wonderful practice. And the Tratak you do about almost 5 to 10 minutes. If you don't have it done, you can do it yourself. And sometimes you can put it in your eyes in a drop, a little bit of a ghee. And it says wonder things will happen. It's a pumping and cupping. It's a wonderful relaxation. You keep on rubbing your hands, keep on rubbing your hands. When you feel the warmth in your hand, put it over your eyes as a cup. Then you massage. You massage the back of your ear. That is called your relaxation response. There is a branch of a nerve called a vagus nerve. And the vagus nerve is an activation of your parasympathetic tone. And I'll show you the practice, how we do it. This is called Tratak, T-R-A-T-A-K. The Tratak is your proper exercising of your eyes, and Jyoti means a flame. This is a flame, and you look at the flame without blinking, looking at the flame without blinking. Blinking is both voluntary and involuntary. Blinking like breathing, like a breathing. You're sleeping, you're breathing, involuntary. It is a function of called the lower brain. But you are voluntarily, you can breathe out, take a deep breath in, and same as the blinking. It's a voluntary control over involuntary function. So let me stop here and let me show you what slide was that? 12 slides. Okay, we'll come back again. We stop it here. Maybe best thing is, let me go back to your, I can be in a gallery view. I'll see all of you. First, what is say, I was going to show you a break called a stretch break. What is a stretch break looks like? I'm sitting in a ground, I'm sitting in the spine. If you're sitting in a chair, it is good. If you learn how to do a squatting pose, I don't know if you can see me doing a squatting pose. You go a little back. Whenever you're sitting down, you're sitting in a chair, wherever, this is a wonderful, relaxing pose. If you can sit down in a squatting pose. If you cannot, do it gradually, do it slowly, do it one step at a time. And so if I can do it, you can do it very simply. Put your hands together, separate your fingers. This is the way your hand gets relaxed. Remember, this squatting pose is you are relaxing your ankle, relaxing your knees, relaxing your hips. Always remember, yoga practice is 99% practice, 1% theory. More and more you practice, like extend your wrist. This is the way wrist gets relaxed. You can put your one elbow inside, other elbow inside. Slowly put your hands together and bring it close to you. Keep your spine straight. Close your eyes. In breathing first, breathe out first. Take a deep breath in. And breathe out longer than breathing in. Do it a couple of more times. Once you're a little comfortable, you'll see all the tension will be gone. You'll be in a profound level of relaxation. Then you will learn how to get up without a support. From here, you'll get up without a support. Let me just show you a little bit more so you'll be able to see me. So what you will be doing it, you'll be sitting down and getting up without a support. You'll be sitting down in a squatting pose, then you will get up without a support. Wow, very nice. Proud of you guys, okay? Now then he will do, let me do one thing here. Let me come back to my bigger, let me make it a little bigger, just 1 second. Go to full screen. You guys don't see me. I don't see myself. Yeah, here I am. I'm able to see myself better. Okay, see how simple it is. Sit down. Very nice. Get up. Wow, great. Now we have to do a little bit more. You guys are going to be yoga teacher, aren't you? You're comfortable standing like this. Put your feet together. Cross your feet. Cross your feet. You sit down. Good, high up. Beautiful. Wow. You guys are talking now, huh? To the opposite side. Remember, yoga always practices a balance. You always do it both sides, crossing your other foot, sitting down, getting higher. Now, you guys have to do one thing. When you do good, you have to pay the dues now. You have to pay more dues. Let me show you another one. If you pass this one, you'll be a true yoga practitioner. Sit down all the way to the ground. Sit down all the way to the ground. Cross your feet down. From here, see if you can get up. If you can get up without a support. All the way to the ground. Okay. If you put your one hand, beautiful, look at that. Sit down or cross your leg in the other side, other direction, opposite side. Oh, I like it. You talk about yoga, putting your body in a pretzel. This is yoga, you know why? This is quieting down your body and mind. It will quiet down your body and mind. Get high up with that. Okay. See how simple when you are relaxed. Now, let me go a little bit back so you will see. If you can sit down in stages, what is the relaxation response? This is called your easy pose. You cross your leg, sit down. Okay. Now, in stages, we say in stages, impossible become possible. It's hurting you. Back off. Find a place where you don't have any pain. Find the place where you started, and then move, sit down. If you close your eyes, do the breathing out longer than breathing in. Remember, lung is a balloon. It has all the wasted air. You need to remove first. Within a short time, this thing will happen. Once this happens, then you do cross your leg to the opposite side now. What do you see now? You feel better on one side than the other side. Why? Because we are lateralized. I'm right-handed, right-footed. I'm always using my right hand and right foot. But you have to do it opposite. For me, I use my left hand. I brush my teeth with my left hand. When you brush your teeth, the left hand will happen. Initially, brush never goes to your mouth. The brush goes to your mouth. Then you know how the right hand goes like this. Once you're comfortable in this, go to it's called your perfect pose. Siddhasana. Take the heel all the way to the back. Put your one foot in the top. Your knee drops down. If it is up here, let it be here. You know why? If you push it down, what will happen? It'll come back. So this is all controlling your mind. All through your five senses. If you cannot do this today, close your eyes. Close your eyes. Then you do a hand mudra. It's called your Ganu mudra and Hanuma, meditation mudra. Touch your index finger and thumb. Slowly and slowly, this thing will happen. But if you push it down, what will happen? It'll come back higher. Okay? So look at that, how beautiful it is going. What is the mind? Why you need to learn the senses? Take the other foot in the top, sit like this. This is called a half lotus. All of the yoga teachers, they can do a lotus. Lotus, but I say, lotus is relaxation. Lotus is learn how to do in stages. Another very nice. If you take your hand, put it in between your toes, it's a relaxation. The more and more you separate your toes, initially, oh my God, your finger doesn't go in. See, for me, I put all the fingers in between my toes. My whole feet is relaxed. Close my eyes. I quiet down all the five senses. I learn how to control my five senses. and this thing happens to me. Go back to the opposite side. In stages, impossible become possible. May not happen in one day. It will happen in 2 weeks. Input, you need about, what our neuroplasticity says, you need about 30 to 40 inputs for your neuroplasticity to set in. Now I'm so relaxed. I'm so comfortable looking at all of you. You guys are great. What I do, take the other foot, bring it up, I sit down in a lotus pose. I didn't try anything. It all came to me because of my practice of quieting down my mind. So what is that? Software over the hardware. Body is the hardware. You guys try to do fixing your hardware, it's nothing going to happen. So that is the first teaching to you this evening. Nurturing your 5 senses. You want to see what happens when you are so relaxed, when you're so comfortable? People, teachers in my age group, you know what they do? They'll sit down, they will talk, but I practice every single day. I share it. Okay, let's see, put your hands on the sides. This is your final test. Push your hand down, your body goes high up, stays high up. So last. Now you're talking about yoga, huh? And stay up as long as you want, as long as you can. And down. What a practice, huh? I love the practice. You guys are great. Okay. What really helps your body and mind is to have a proper posture. You have a proper eyes focusing. What does it mean? If you're driving a car, your tire needs to be properly inflated, tire needs to be in a balance. So both the feet is your tire. Both the feet should be adequately balanced. So you will see when I'm doing standing high up. So if you guys want to one more practice, let me show it to you, this practice, which which probably you will be doing and you'll be loving it. You're standing up. Where did I go? I lose the laptop time. You are standing up, put your feet together. You always fall down in your hands. Put your hands in the back. Do a prayer pose in the back. Put your hands. See if you can do a prayer pose. And we'll do it more and more throughout the next day. Now what we'll do, if you're right-handed, right-footed, see if you can stand on the left foot. Stand on the left foot. My gosh, initially is impossible. 10 seconds, 20 seconds, 40 seconds. Then close your eyes, see if you can stand closing your eyes. Almost became impossible initially, but you will do it. Do it opposite side. It's not doing the balancing, you're doing a tree pose, or you're doing, this is just able to stand on one foot with the hands in the back. When you're comfortable, what you can do, you can bring it up, you can do a tree pose with the hands in the back. And you'll see it's a lot different than the way you guys do a tree pose. If you do a tree pose in the hands in the front, try tree pose, hands in the back. You'll see a difference in your practice. Okay, getting up to the other side too. When you're pretty well relaxed, you generally don't do a pranayama, but if you're relaxed, you can do a called Kapalbhati pranayama, breath of fire. These are called advanced practices. They're not advanced practices. They're basically practicing quiet down your mind. Okay, let's do some eye, because since we're going to do the eye exercise, what the eye needs to be done. So if you're both the legs are properly balanced, that means both sides of your brain. Remember, right brain controls your left side of the body, left brain controls right side of your body. As simple as it is. Right brain is intuitive, right brain is cooling, right brain is female. So, it also controls your left nostril. So left nostril is a cooling. When you do alternate nostril breathing, we'll teach you. Same way is the left brain. Left brain is heating, left brain is made. So when you're both side of the brain is in a balance, you are in a health, because health is called a balance of your body, mind, and spirit. Whenever you're a little uncomfortable sitting down, best way is to do, take your hands, let me show it to you, do this prayer pose to the back. It's a wonderful practice. Slowly put your hands here, slowly get your hands high up here. And if you stay in the posture, close your eyes. Remember, senses, control your 5 senses. Close your eyes, close your ear, close your mouth, close everything. Hands will keep on going high up. More and more relaxed. It's a wonderful practice. And we'll show you when you do this practice and when you do the neck movement. Neck movement, I'll show it to you. Neck movement is called a relaxation of the neck. Improves your vision. It's called a Brahma Mudra. And we'll come back and show it to you. So the first practice is you have to be sure your eyes are in balance. That means you are driving, you're tired, your feet are your tire, your eyes are your steering wheel. So the best way to do it is that you take your hand, take your one finger, and bring it slowly close to you, keeping your gaze on this finger. This improves your vision, and it also balances both sides of your brain. Many a time what you can see, if you have an imbalance, I have done it many times. This is a nice trick. All of you have this cell phone. What I do with this cell phone, you guys will laugh at me, but it's okay. You take a selfie. So see what I'm doing. I'm taking my finger, I'm bringing my finger close to my nose, and I'm trying to see this finger with both the eyes. Sorry. And I am bringing my selfie close to me. I'm looking at my fingers, both the eyes, I'm taking a selfie. Why? Now I can go back and to see the imbalance in my eyes. Both of my, you won't be able to see it, but if you see it, both of my eyes, you won't be able to see it. Both of my eyes, the eyes, I can have, maybe my eyelid will be open a little bit, but I can see when my finger is in the nose, both of my eyes in the same distance. If you're not in balance, it will be in imbalance. One will be One will be looking at this and another will be on the other side. Do you understand what I'm saying? When your finger is here, the pupil that is distant from here to this eye and here to this eye will be equal. And this is a fun thing to do with your selfies. You know, people says I'm great in selfies. You know, that's great. Take a look at your eyes. No, see, ZYA is trying. All right. Next, what you do, that you exercise the eyes. The eyes are supplied by called cranial nerves. You have the nerves coming from your brain, nerves coming from your called spine. We have 12 cranial nerves. In the eyes are supplied by the 4 cranial nerves. There's a muscle in the eye supplied by the 4th cranial nerve called superior oblique. Yes, we remember when in medical school, SO4, LR6. Superior oblique supplied by 4th cranial nerve. LR6, lateral rectus supplied by the 6th cranial nerve. Bless you. Then the main optic nerve is called a second nerve, which is the optic nerve, which carries all the sensation to your brain. And there is called a trigeminal nerve, 5th nerve, which supplies everything. So what you need to do, this is called a practice called a tratak. You're going to move your eyes. So you have 2 thumbs. So take your 2 thumbs all the way outside. You are not going to move your neck, not eyes. With the eyes, just look to the right, look to the left, look to the right, look to the left, look to the right, look to the left. Tilt your hands high up, look right up, look left down, right up, left down, right up, left down. Tilt it other side now, look left up, right down, left up, right down. A few times, then what you do now, look high up, look down, look high up, look down, high up, down. Now you do look high up, to the left, to the bottom, to the right, up, left, bottom, right, up, left, bottom, right, up, left, bottom, right. Other way, up, right, bottom, left, up, right, bottom, left, up, right, bottom, left. Wonderful practice. When you do this eyes movement, your vision gets better. Another way to do it is that you have a flame, you know, a flame of a candle or a flame, or just simply put a 1 finger in front of you and keep looking at it. Look at this finger, so I can see. Look at this finger without blinking as long as you can. Don't blink. Let even water run through your. You can be doing 20 seconds, 30 seconds, for a minute. Just keep looking at it without blinking. I can continue more, you know. So the question comes, All my friends, my doctor friends, my friends and families will say, oh, you don't take any medication. No. You don't wear glasses. No. That's the end of the questions. They never ask me the second question. And the second question is, pardon my expression, my expression is, what the hell do you do not to wear a glass, not to medication? They will never ask you that because they're so programmed. Yes, I have a vision problem. Take it, go put glasses on. I have a little high blood pressure. Put some pills on me. Take some pills. Pills are no good. It has a lot of side effects too. Okay, these are powerful practices. Another practice is the neck relaxation. What happens when you learn how to relax your neck? Neck is supplied. There is two muscles. There is a muscle. This when you turn. If you see this muscle, this is called a sternomastoid muscle. This muscle and this muscle called a trapezius muscle. These are supplied by called a cranial nerve. It comes from your brain and the same area where the nerve comes from your eyes. So when you learn how to relax your neck, the word is called a Brahma Mudra. Brahma Mudra, Brahma is the name of the divine and Mudra is your gesture, and we'll come a little bit later. But let me show you the practice. This is a wonderful practice. This all, your teachers say these are all advanced practices. There's nothing advanced practices. This is a combination of all the practices you have, but to create a sense of your therapy. Another practice is called exhalation with the sound of a bumblebee. Bumblebee improves your hearing. It improves also your vision and relaxation. And let me show it to you. Bumblebee breathing is called a Bhramri Pranayam. It shuts down all of your senses. Then you create a vibration. Your brain is in a state of vibration. You create a vibration. Two vibration intersects, cancels, and quiets down your mind. So the technique is you put your index finger in the forehead, use your 3 fingers to close your eyes, use your thumb to close your ear, and then close your mouth. You all do the breathing through your nostril. You breathe out through your nose. You will take a deep breath through your nose and breathe out with the sound of a bumblebee, like this. Next, you take both the hands, keep rubbing your hands. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses, take the hands like a cup, put it over your eyes like a cup. Let the eyes take all the heat from it. Massage your forehead, massage your eyes, massage your face, massage your ear, behind the ear, front of the ear, in front of the ear, inside your ear. I have the ear pods, so I'm just massage it because ear is supplied by a nerve called your vagus nerve. Bring your hand, massage your neck, in front of your neck. Massage it to the back of your neck. It's a wonderful practice. More and more you relax, more and more your vision will get better. More your mind will get better. Now it's a relaxation. Let's see how simple it is. Put your hands in the back, do a prayer pose to the back. You are shackled now. You're chained. You're not going to go there. If you keep it here a little longer, I teach it to all of your computer people. The computer guys have a highest number of your lifestyle related disorder because they're always hunchback. They're looking at this computer. I say, keep your spine straight, put your hands into the back. Now see what I will do. I will move my neck. I'll put it in the back. I'll breathe out first. I also always do with my eyes closed. I'll take a deep breath in and slowly drop my neck to the back. And when I'm breathing out, putting the neck in the front, I will be doing a sound of a bumblebee like this. Now, always remember, do not compete with anybody. You listen to your body. Somebody will come and say, oh, I went to this yoga class and next day I was hurting, I was having pain. Never. What you'll do with your eyes closed, you don't know who else is doing what. First, when you do put your body down, there should not be any pain. If you bring it down here, if you get a pain, you back off. So your body, your mind, and your breath should be effortless. If you come down here, if you feel there is an effort in breath, back off. Very simple. Breathe in, breathe out. Go side to side. Breathe out first. Take a deep breath in. So proof is in the pudding. What is the proof? I'm talking for 2 hours to you. My mouth is wet. I have a saliva in my mouth. When you have saliva in your mouth, it's called parasympathetic activation. Like when you're scared, when you have a sympathetic overdrive, what happens? You get a dry mouth. Next is to look all the way to the back without turning your head, then you rotate your neck. Breathe out first. Take a deep breath in. Drop your head down. Breathe out first. Take a deep breath in. Slowly rotate your head. Opposite side. These are called extending your exhalation. You extend your exhalation, you'll see, you will have all of them is here. You know, this is my book called Yoga Therapy, Ayurveda and Western Medicine, called Healthy Convergence. And all of you should have this book because everything I said is all in my pictures and all the explanations, like everything you do, why you do it, how you do it, what are the contraindications, every asana, every pranayama. It's almost like a textbook for all the yoga teachers. I have a DVD, but the DVD, there is nobody DVDs player anymore, but these are all in my YouTube too. Do my YouTube channel, you will see it. Now, we have 10 more minutes. If you have any questions, if not, we have a few more slides. I can show it to you how to do the other senses, or maybe we'll continue these practices. Now, let me tell you one thing. Tomorrow, I have a scheduled class tomorrow at 9:30 in a Facebook. You guys are all in Facebook. Who is not in the Facebook here? Who is the black sheep of the family here? Not been the Facebook, huh? Man, I never been to Facebook, but I have been compelled. COVID-19 pushed me to Facebook, huh? So 9:30, I start a class in. So we'll get together at 9 o'clock here. We have a little chit chat tomorrow in the morning, 10, 15 minutes more. Then all of you will join me in Facebook. Do you have my Facebook timeline? You should have it from Linda, the email she sent you. So join in that Facebook, huh? And you know the word Facebook came from? The kid is doing Facebook all the time. His mother says, you know, put your face in the book. It works better, huh? Put your face in the book. I'm looking at my gallery view and you guys look wonderful. You know, this is a very nice. You should see in the gallery view too. You don't have to see me. Let me go back and let me share again a few more slides. And then if you have any questions, if you have any comments, I'll be glad, you know, when you guys talk, I listen, you know, I'm a talker, but I'm a listener too. We are here. Okay. Let's see if you guys can see me. You see it now? We're talking about Tratak here, huh? This is called the Brahma Mudra. We're saying that the eyes are supplied by the cranial nerves, relaxation of the neck. These are the practices we do. It's called a Brahma Mudra. To the back, to the front, and you do it a sound of a bumblebee. This is on the side, the right side and the left side. This is turning all the way to the back, to the right and the left. Then it's turning your head to the left, to the back, to the right, to the front, and front to the back, to the left, and the back to the left. Very, very important practice for relaxing your eyes and getting better. This is the fascinating thing if you want to do it. People are not comfortable doing it. It is called a glasses off. This is the iPhone app, but I do it all the time, not with the app. If you keep on looking at a blurry vision, blurry picture, eyes try to correct, and these are, remember, it's called art of self-healing. Every organ heals itself. Vision gets better and better. I tell you one, sometimes when I wear a little bit of a reading glasses with a 1.5, I see blood better, obviously my age. But then I take it off, my whole thing is, but I'd like to read as small as possible, read all the blurry pictures, blurry words, my vision gets better. People don't take this thing to do. This is called a gel neti. We'll show it to you more and more. What is a, you put a little bit of a lukewarm water and a non-iodized salt, put it through one nostril, it comes out. Then you blow it, and how to do it, I will show it to you tomorrow, Dinocharya. But again, 5 senses. When your smell gets better, when you breathe better, your vision gets better. 5 senses are all intermingled together. These are the 2 breathing techniques called alternate nostril breathing, and it's called a bumblebee breathing, which we just did, bumblebee breathing, and called pumming and cupping, and alternate nostril breathing. It helps in your vision. Hearing we do is the bumblebee breathing. It helps in hearing. Another hearing is called we call it a Valsalva. It's a big Sanskrit name called Karno Rogantar Pranayama. Karno means ear, means remedy. Basically what it is, you breathe out first, take a deep breath in, and then close your nose, close your mouth, and try to breathe against the resistance. It opens up the 2 tubes going to your ear. This will happen a lot more during your, like when you are, I'm sure all of you have experienced that when a plane is coming down, your ear gets blocked with a tube called eustachian tube. You can even swallow it, it opens up. Another yogic practice is very, very powerful practice they do when they're putting in the body. They do an oil massage in the body. They put one oil drop in the nose and one oil drop in both the ear. Little oil there, it doesn't get dried up. It gets very oily, and it's a wonderful practice. You'll see, and I do it too. I do an oil massage, and I have one called a steam box, and I'll show you to the pictures how to do them. Hearing, obviously, a nice music, a nice vibration helps you hearing, and doing some work or practice, eyes closed, improves hearing. Remember, when you shut down your senses, other one gets moved. Like a blind person, the tactile sensation gets gained. So when I do my yoga practice, I always do the hand mudras. There's a mudra called a Adhi mudra. I'll show it to you when I do it. I do it with my eyes closed. This is for the taste. This is called a tongue scraper. And when you use the tongue scrapers, and tomorrow I'll show it to you how to do the tongue scraping in our daily routine. We'll go a little bit more in details. This is also called called Ujjayi Pranayam. I will do a little bit slowly and gently. We constrict the larynx and try to breathe in as if you're trying to breathe against a resistance. When you get a little cough, that's where this comes from. We'll do the practice tomorrow again with this, and you'll see that pushes the tongue in front, and it keeps the tongue more functioning to have the proper taste. Smell, obviously, cleansing your nose, called a jalneti, called it a neti pot, and neti pot is available everywhere. Even nowadays, Walmart even sells it. It used to be in a health store. Now it is available in Target and Walmart, and remember the smell when the nose is open, nose is clear, and smell and taste is interdependent. When smell gets better, taste gets better. Taste gets better, smell gets better. Little bit of a lavender, called your essential oil. Lavender oil helps very much in your smell. These are all you have. Now I gave you all the slides, so don't worry. We'll keep you all the information. Now this is called your touch, called your Abhyangam and daily massage. You put a little oil. Generally, for the Vata people, you use a sesame oil. For Pitta, you use a coconut oil. Kapha, use your mustard oil. But mustard oil is warming, and in our lifetime now, it's our Vata time. And I use a mustard oil, massage the body. In the periphery, you go from outside to in, and inside you go from center to the out. You're self-massaging your body, put an oil. Then generally in Ayurveda, it's called your steam box. I get into a steam box, and a steam box, it opens up all of your hair follicle, all the oils. Initially when you put the oil in the body, slowly it just goes up right away. This is a wonderful practice. Again, self-massage. Following the self-massage, it's customary to use a little shower or a steam box, and it's a wonderful practice. So tomorrow, as I said, we'll join around 9 o'clock. We'll see if you have any questions. We'll get over and what we discussed, what we have done today. The 9:30, you join me. We'll be doing about maybe hour and a half. Generally, it's a 2 hours class I do. I've been doing it for years and years and years. And when you come to Sattik space, who missed me in the Sattik space? Somebody said, you came to Sattik space, you meet me? Kendall, huh? So I've been doing it for a long, long time. So getting over time is coming. And, for me, it is so relaxing for me. I can continue whole night if you want me to, huh? But you guys won't be liking it. For me, people say, how can you talk so much, I said, I don't know it when I'm talking, you know. I'm not scripted. I share everything. I share everything. I get to give scripting, just give it to you guys, you know. I make all the slides, not for me. I gave it to you. You know for what? I gave it to you so you can carry the flag and keep the yoga alive. Okay, Jaya, you'll do it, huh? Any question? Lee was doing good. I saw you, you know. Keep doing it.
I want to say something. Oh, wait.
Sure, go. Yeah, please do. Shut down your one. You said one source. You have to turn it off on
Okay,
source.
hold on. Let me shut down one of these.
Yes, one of these.
Okay.
You cannot have two sound source. Okay, go ahead.
Better? Okay.
Yeah.
I just wanted to say that first of all, back in the 90s, I had a lot of experience in the hospital. I worked very closely with students and things like that at EBMS. But I didn't stay in the nursing field, but I'm very familiar with, how the doctors behave, partially because I had a very sick 8-year-old boy and he was in and out of children's hospital. But I just want to say that I'm very impressed with the fact that you are a heart surgeon and you are using, Ayurveda medicine and things of that nature as a line of defense, because I've had my father, my brothers, all of them have had some sort of severe heart surgery. And none of this, they kind of look at me like I'm crazy when I mention anything that's holistic. They're like, that's not what my doctor told me. So I just want to say thank you. Thank you. The flag will definitely be carried on, and I just appreciate you. I know how tough that can be in the medical field.
Understand. No, it's very simple, because most of our Western trained physicians don't understand that this is a relaxation response, activation of parasympathetic tone. It is totally counteracting the effect of stress. And remember, the stress is causing, you look at our grandfather and look at the people who have been comfort in life, like my grandma lived up to 95. She ate a little bit, nothing. Her biggest, it's the quality attribute she had, nothing bothered her. Sharon, you're here. Come on, Sharon, sit down, eat with me, sleep with me. Today, Sharon is coming. Oh my God, what I'm going to cook for her, what I'm going to serve her, which room she's going to be. Let me fix the bathroom. Let me put a nice towel for her. The constant, this irritation. That's a Western physician still don't understand. And that's the reason I teach. And I teach because physician has seen me, the transformation. That's what helps them. Okay, time for, I don't know what for you guys, dinner, sleep, chit chat, gossip, watching late night? No, 10 o'clock is your bedtime. Tomorrow we'll talk about daily routine, Ayurvedic daily routine. Then I will give you a practice. I'll do practice, Vata balancing practice, Pitta balancing practice, Kapha balancing practice. Then I'll give you the sequences, Vata sequence, Pitta sequence, Kapha sequence. And if you look at all the slides I give it to you, I put them in every section repeatedly. I'm looking at my schedule. We are all have to stick to the time 9 to 5, okay? Because these are requirements. Tomorrow, the time will be the FaceTime, not a Facebook. The Facebook we have that is included in your timing. Generally, we also take the breaks. When we are doing it in our studios, oh, this was so fun. We used to go out to have a nice lunch. We used to go to, what's that nice food? They have a Taste Unlimited is one, or there was a called Nawab. Nawab is the Indian. And then after you eat, we all talk about Ayurvedic digestion. What do you eat? How do you do? Sunday morning, I have another commitment, but what we'll do is start at 9 o'clock. And then once you start practicing, I will put one of you in charge and you will keep on practicing. Remember one thing, there is nothing short of practice. Yoga is, as I said, 99% practice, 1% theory. Once you start practicing, you know what will happen? All the theory will come to you. You don't have to practice anymore. You have to study it anymore. Any other comments? Any other questions? You guys are all, I see the happy, smiling face. You should all put in a gallery view so you can see each other's face very nicely. All of you are glowing. All of you are with tejas. Huh? Good night. See you tomorrow, 9 o'clock. If you guys come early, it's fine because I put a link so you can guys join before me. So come join. You can even chit chat amongst yourself. This is social media these days, and looks like this is going to be the norm now, you know. Okay. Good night. Bye-bye.